Good evening and welcome to Chicago Tonight. I'm Paris Schutz.
And I'm Brandis Friedman. On the show tonight,
it's been a lot.
When will students resume learning? The latest on the standoff between Chicago Public Schools and the Teachers Union.
I broke away to be here in support of our members. And look at them. They don't deserve this. They shouldn't have to demand this.
Plus, one-on-one with Chicago Teachers Union leadership.
On this anniversary of January 6th, let's confront the anger.
Congressman Adam Kinzinger makes a career decision on the eve of the January 6th anniversary. Our Spotlight Politics team weighs in.
We've turned our lobby into an emergency room.
A record number of hospitalizations has healthcare providers on edge, how they're working to maintain capacity.
And record high COVID hospitalizations for children in Chicago. A local pediatric infectious disease doctor weighs in.
And son of a gun, when we put it in the French fryer, it held together.
And a look at the fourth-generation family business that created one of Chicago's most enduring fried fast food favorites. But first, some of today's top stories. The White House weighs in on Chicago teachers refusing to teach in person. The Chicago Teachers Union voted last night not to be in school until as late as January 18th due to frustrations with COVID mitigations from CPS. White House Press Secretary Jen Psaki says President Joe Biden still urges students and teachers to be in class as opposed to remote.
He agrees with medical, scientific, and education experts that because of the historic work we've done, we are more than equipped to ensure schools are open. And we're going to keep our children and educators who selflessly serve their community safe, but ensure that children are not enduring the mental health impact of not being in school, that there are not gaps in learning. This includes schools everywhere, including in Chicago.
And another new record for daily COVID cases in Illinois today. The state recorded more than 32,000 new cases in the last 24 hours, with 79 additional deaths. That brings the total case count to nearly 2.3 million, with 28,156 confirmed deaths. The test positivity rate leaps up to 18.4%, and the state sets another record for hospitalizations due to COVID as well. And we'll have much more on how area hospitals are coping in just a minute. And Governor J.B. Pritzker announces he'll be working remotely for the time being after being exposed to a state employee with COVID. The governor says he himself tested negative this morning, but is taking the measure out of abundance of caution. Pritzker says he's fully vaccinated and boosted against the virus. The race to replace longtime 1st District Congressman Bobby Rush gets a new high-profile entrant. Third Ward Chicago Alderman Pat Dowell says she is running for the seat. Dowell had been vying to win the Illinois Secretary of State's office, but failed to get the endorsement of the Cook County Democratic Party. Rush announced his retirement from Congress yesterday after nearly 30 years in that seat. Meanwhile, Illinois state government's fiscal picture is improving. State Comptroller Susana Mendoza announces Illinois has fully repaid a $2 billion COVID loan from the federal government 6 months early. Mendoza says that means taxpayers will save $82 million in interest payments. Officials cited the state's improved economy as the chief reason for the early repayment. And up next, the latest on today's school closures, so please stay with us.
Chicago Tonight is made possible in part by Alexandra and John Nichols, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
CPS classes were canceled today, and that is going to extend to tomorrow at the very least, according to recent comments made by CPS CEO Pedro Martinez. And Amanda Vinicky joins us now with the very latest on this standoff between Chicago Public Schools and the Chicago Teachers Union. Amanda, no schools tomorrow. Take us behind this decision.
Yeah, Paris. So Chicago families didn't learn until 11:30 last night that classes were going to be canceled today. They've got a bit more notice for class on Thursday. As you noted, we just learned from the head of Chicago Public Schools, Pedro Martinez, that there will again be no class at CPS on Thursday. However, he does say that at least at some schools in-person instruction could begin as soon as Friday. He says that he drove by some schools, saw students trying to get in, and he said that they were crying. Martinez likewise saying that he continues to believe that treating any COVID and closing the schools system-wide, as he turned it putting a hammer down district-wide, is not the solution. He is going to continue, he says, to negotiate with the Chicago Teachers Union. Negotiations did take place this afternoon by bargaining members from both sides, that while CTU members spent the afternoon at a car caravan demonstration rather than teaching. This all because teachers voted late last night to go remote, citing unsafe conditions in schools. That is in defiance of school administrators, public health officials, and the mayor, who say that schools are actually the safest place for children given community spread of COVID. Now, knowing that most teachers would not show, even though it meant that they would not be paid, CPS administrators say they had no choice, both staffing-wise and by law, to cancel class for today and also for tomorrow. The district says that CTU in here is taking illegal action and prevented teachers who did stay home from logging onto their work emails and into their remote classrooms. In an interview this afternoon with WBEZ, Mayor Lori Lightfoot says there's no data to show the reason to close the entire city's school system. And she says CTU leaders, not the teachers, but the leadership, she says, did it because it gives them power. Here she is yesterday.
We don't need a one-size-fits-all strategy. We need to lean in to the science and the data and not push that to the side and give in to fear-mongering and hysteria.
Lightfoot says that remote learning causes lasting harm to students, particularly students of color who really fell behind during the pandemic. But CPS high school student Caitlin Savada says that students and teachers, what they're facing daily is different than what the mayor and the CPS CEO experience when they pop into schools for a brief bit for a photo opportunity.
Folks in community, right? Myself as a student, teachers, staff, families, like what are you talking about? Because this is not being implemented, right? Safety measures are not being implemented. This is not what structures of school look like. I heard the CEO himself say yesterday that every single one of our kids are wearing masks in school. The CEO was at my school on Monday, and I know he didn't see every high schooler at my school with a mask on.
Erin Copeland is a longtime CTU member. She's a school counselor. She's actually married to a CPS teacher, and she has children who attend CPS schools. And she says that there are trust issues with the district. And Copeland says that there are trust issues with the district. Copeland says that COVID is different now with Omicron and cases raging.
Feels like Groundhog's Day in that I feel like we're always arguing with each other. I always feel like there's something that we're always not agreeing upon. So yeah, in a sense, yeah, Groundhog Day with not working together as a team. And it's frustrating, I think, on both sides. But things are different.
Again, different because of Omicron, and she says that the CPS has not adjusted to that change, not providing enough PPE, she says, nor enough frequent or reliable testing of COVID. And that is why she voted to go remote. She says it was to take a pause, time to get that remedied.
I felt that it was the right strategy, I guess a strategy in that we need to make change. And the vote was to just go remote. So that is, it's one of the things that I also want to make sure that a lot of people are clear on, that we're not on strike. So teachers don't want to stop working. Teachers want to continue working. They just want to work remotely because they think it's the best option right now until we figure out a better solution.
She says there's no true right answer here, but she personally will be comfortable going back to the classroom once she's provided with KN95 masks and also once that curve of the rising cases falls down some. Now, Vanessa Chavez is a mom, also a stepmom to 3 CPS junior high students. Chavez says that she had been dreading a day like this of classes getting canceled.
I was afraid it was going to happen. My biggest, I think, the biggest frustration is always when, I'm in healthcare. So I follow the numbers, COVID numbers, we track them daily. And so my biggest frustration is knowing when mitigation efforts actually work, and how much pain and effort and sacrifice has been put into figuring out what works, and then having, an organization come and say, well, no, that's all a lie, and kind of debunking the science behind keeping, people safe.
Chavez says that she feels bad for her kids. She says that they were on track to healing and recovering from the tumult of the pandemic and from remote learning. She says how CPS is still new, relatively new. CEO Martinez has handled things well. She likes that.
Levels of frustration. Highest frustration goes to CTU. Again, the misinformation that's out there, the trying to scare families and scare their members, using lies and denouncing actual data and public health officials and their guidance. The majority of my frustration lies with them.
So still for families, Paris, no real clear answers on what is going to go on the rest of the week, with Martinez indicating that perhaps school could be back in as early as Friday, but for sure, no school tomorrow as the standoff between CTU and CPS drags on. And I know that we'll have more later. So for now, tossing it back to you in the studio.
All right, Amanda, a lot of frustration for CPS families right now. Thanks very much. And now to Brandis Friedman and one of CTU's leaders. Brandis.
That's right, Paris. So, of course, questions still remain for thousands of Chicago public school parents and students. Just an hour ago, we spoke with Chicago Teachers Union Vice President Stacey Davis Gates to get more on the status of this stalemate between CPS and CTU. We should note that we also invited a representative from CPS, but they were unable to join us. I began by asking Davis Gates how she'd describe today for her members and how they're feeling.
Frustrating for many of the members this morning when they went to log on and found that they were locked out of their classrooms. Many had communicated to their families that they would be logging on and could not. So they spent a lot of time today calling families, touching bases with them. This afternoon, there was a car caravan. Several of the educators that I spoke with today spent the afternoon taking work to their students, making sure that families had good instruction and so forth. So just a lot of work to scramble around. We did not expect to be locked out of our virtual classrooms.
Now, that said, the district is calling this action, an illegal work stoppage. Since the union can't make the determination on when the district goes to remote learning, it is the district that's supposed to make that decision. And of course, you and I both know a lot has to happen before an actual strike can occur. But is this, in effect, a work stoppage? I mean, is that what you would call it?
No, I wouldn't call it a work stoppage. It was very obvious that it is a remote work action. Similar to what was done last year, where we could still interact with our students and provide some instruction to them. Look, I can't answer for our mayor. I just can't. I just know that our members want to be engaged in instruction again. Brandis, many of the classrooms in our school communities on Monday and Tuesday were doubled up, tripled up. They were in cafeterias, they were in auditoriums and gymnasiums because there were no adults to staff or instruct. Instruction is not happening because of COVID. People are catching this, and it has been difficult to keep stability, which is why testing is important, which is why vaccinations are important. And we are trying to convince our mayor that these things need to be implemented in our school communities so we can not only open, but we can remain.
And of course, Stacey, what a lot of parents really want to know is how long do you plan on staying out of the building? Under what circumstances would you return before January 18th?
Well, I think that has a lot to do with our mayor. She's in control of our school district. We've been begging for collaboration for a very long time. Today in bargaining, I would say is the first time in months that, we got transparency, good discussion, the passing of proposals. And that's only because our members took action. And it is a shame that our members have to take action in order to get her team to be truthful at the table, to pass proposals at the table, to engage and interact at the table. Typically, it's a lot of no, It's a lot of, waiting and holding the ball. Today, there was, a lot of back and forth. And so we see that as a positive development. And we hope that the mayor can, give us an indication of her opening back up our classrooms so we can teach tomorrow and get to an agreement that makes the most sense.
So yesterday we heard from CPS late saying that they have proposed to you 200,000 or distributing 200,000 KN95 masks to staff and more throughout January, allowing principals to make the decision on reinstating the health screener and the temperature check policies at schools, as well as on-site testing at 100% of schools, while still allowing schools themselves to make it at the school district or the school level, to make the decision on returning to remote learning when certain conditions are met. What has been your response to that proposal? Because I don't think it quite lines up with exactly what you all are asking.
Well, it doesn't. It doesn't speak to the frequency of testing. We've talked a lot about opt-out testing. We know that the school district in Evanston is doing that. Thornton School District, both school districts are doing opt-out. We believe having an opt-out mechanism helps us get more children into the testing regimen. Gives us a better opportunity of catching the virus before we have a situation like we had at Park Manor, where like 80% of the school community was in quarantine because of the virus. We need those mitigations in place. And, and I'm going to be a broken record on this. The Biden administration sent the Chicago Public Schools $2 billion to put these mitigations in place. And they have not been administered in a way that helps us give our students traumatic supports, that helps us help our students recover from the time that we were not in person. We don't have testing working. You all saw the testing debacle. These things require administration, they require leadership, they require collaboration, and that is what we're hoping to land with the mayor.
So on the topic of the mayor, in a press conference yesterday, Mayor Lightfoot addressed the decision that your members took. Here's a look at a bit of that.
What happened when we went to all remote learning as the CTU leadership is challenging us to do? What we saw is 100,000 children, particularly among Black and brown children, that were disconnected from the system and learning. We saw a threefold increase in the number of failure rates among elementary school children. Not only that, we heard from parents how disruptive that remote learning was to their lifestyles.
Now, Stacey, this has obviously caused whiplash and frustration for so many parents who were up late last night wondering what to expect today. What do you say to the parents who are concerned about this kind of tension and discord between the district and the union and the impact that it has on them and their students?
So a couple of things about that. I'm a mom as well. I had to hush my children before, I logged on with you. This has been extraordinarily disruptive. And it has been disruptive since we started in September. I've said this before, my 7th grader doesn't have a reading, science, or math teacher. Those are critical classes in a critical school year. So this disruption is being felt by everyone, and it is unfair. It's so much so unfair. This is what we're saying. Where's the $2 billion? Our mayor brings up all of what was wrong, but has not implemented any policies or practices or hired the necessary people to address any of the issues that she continues to enumerate. We don't have more social emotional supports in our school community. We don't have more substitutes in the building to cover classes because we know staffing continues to be an issue because people are getting sick.
And Stacey, sorry, we're just out of time, but it sounds like obviously you'd like to see a lot more out of the mayor. We hope to hear from her at some point as well. For now, that's where we'll leave it. Thanks for joining us again.
Hey, thank you. I appreciate you.
COVID hospitalizations for children have reached a record high in Chicago. The city is currently seeing a daily average of about 7 hospitalizations. And despite these numbers, some data suggests that the Omicron variant is causing a milder illness in children. Joining us with more is Dr. Taylor Heald-Sargent, a pediatric infectious disease physician at Lurie Children's Hospital. Welcome back, Dr. Sargent, and thank you for joining us again. So first off tonight, we had last night Chicago Department of Public Health Commissioner Dr. Allison Arwady on the show, and she spoke about the spike in hospitalizations. Here she is.
even before vaccines were available, the rate, thank goodness, that we are seeing children hospitalized with COVID is very similar to the rate that we see children hospitalized with flu in a typical year.
Would you say, Dr. Field Sargent, that you're seeing the same pattern at Lurie?
I can't speak to the number of flu since we haven't had that in several years to the same degree as we've had COVID, but I can say over the past 2 weeks here, we've had over 110 patients be admitted with COVID-19 to our institution, and about 20% of them had needed ICU level care. So it's not an insignificant amount of children. It's the most we've had since the pandemic started.
The most you've had since the pandemic started. In that same interview with Dr. Arwady, she did say while the numbers are rising for children, it is still rare. But from what we're hearing, 110 admissions in the last 2 weeks, that sounds like a lot. How would you put that into context for us?
So it is a lot. And although everyone keeps talking about how Omicron is slightly milder, it appears, and overall COVID is milder in children, when you have large numbers of infected individuals, the rare events are going to occur, and those rare events are hospitalization and severe illness. So it has been pretty high amounts recently for us.
Okay. As you just said, Omicron said to be milder in children, but we are seeing these climbing, infection and hospitalization rates for children. Is it a matter of, comorbidities and, other health issues that are putting these children in your care?
Certainly that's some of them. Also, you have to remember that a large proportion of our children are unvaccinated, not because of choice, but because they don't have access to vaccines, be that through their parents' decisions or because they're less than 5 years old. Over half of our patients that have been admitted recently have been less than 5 and unable to get vaccinated because there's just not a vaccine for that age group. Some of them certainly do have other comorbidities, but some have been otherwise healthy.
What would you say is, we've heard, reports from some hospitals as well, children's hospitals across the country, that children are being admitted for other illnesses and testing positive, at the point of admission and having been otherwise asymptomatic. Are you experiencing that as well?
We've seen that in about 25% of our cases, that children might present for other reasons and are found to be COVID positive or admitted for reasons that thought not to be related to COVID. But still, the vast majority that are coming in positive are being admitted for COVID-19.
Okay. Are there symptoms that parents of young children should be looking out for?
So the things that people have been watching in general, a cold that progresses into a cough, seeming like they're having difficulty breathing. For young children, that can be hard to figure out because they can't always tell you if it's hard for them to breathe. So watching to see if they're breathing faster than normal. If it seems like they're working harder, you can see some tugging at their muscles in their chest or their neck. If they're sleepier than usual, or if they're having trouble keeping down fluids. So sometimes the GI, the gastrointestinal, so vomiting and diarrhea can be a component of this, and just keeping kids hydrated can be a challenge.
Would you say, are you seeing a difference between how Delta, the Delta variant affected children compared to Omicron?
So luckily, we didn't have the same spike up in this region with Delta that was seen in the other regions. And so our Delta infections were manageable in that there were lower number. Here, I would say, although we are seeing a lot of respiratory illnesses, it's similar in presentation to Delta.
What impact would you say, this increase in patients up to 110 over those 2 weeks, how is that impacting your resources there, your staff, and your ability? Obviously, you're a children's hospital, so you're designed for it, but that's a large influx of children.
Yes, and we are designed for it. This is something that we expect in the winter time, is our busy time with respiratory viruses and with flu, as Dr. already said. It's not unheard of for us to have issues, but the problem that is compounded here and other hospitals is, number one, that we're all weary. And so adding to already pandemic weariness and fatigue, and then that our staffing is actually affected by the pandemic. So we're not alone in the fact that we're having issues with staffing. And so it's not just the number of beds and the number of patients, but it's the number of care providers that have. Luckily, we're able to keep on top of things, and our staff, our infection prevention and control has ensured that we have enough personal protective equipment and masks to go around. But it's tiring.
Doctor, obviously, all day, a lot of us have been talking about the argument between the Chicago Public School District as well as CTU about children returning to their classrooms. You know, do you have any concerns about children being back in the classroom affecting the number of patients that you see there?
I think in general, we just have to remember that we need to keep up all of our mitigation efforts as best we can. Vaccination, testing, masking, good ventilation, those all need to be in place to keep the rates as low as we can get them. Sometimes schools are able to provide those, and I think that that's the main factor, is that if schools are providing those mitigation factors and kids are in those relatively safe environments, then it can be done well and it might not impact our rates as much.
Okay, we'll have to leave it there. Dr. Taylor Heald Sargent, thanks for the work that you do and for joining us.
Thank you.
And there's more Chicago Tonight ahead, so stay with us.
I come from a people that not only found a way to survive through the most horrific circumstances, but they thrived.
I could not save one of the boys of color in my own life. If my family could be exposed to this horror, then really it could happen to anyone. We are truly all in this together.
There's much more ahead on the program, including the race to replace outgoing Congressman Bobby Rush. But first, from Saganaki to the Jibarito, Chicago's blend of cultures has resulted in a long and delicious list of culinary innovations. One particular Chicago food favorite started with an Assyrian family that folded together Italian and Mexican ingredients to create a hot dog stand staple. Producer Erica Gunderson has the story, and we admit it's a bit of a puff piece.
There's no other city that I know of that's better at doing quick service items. And certainly pizza puffs are a big part of that.
The pizza puff has been on the menu at Byron's Hot Dogs for more than 40 years. Byron's president Mike Payne says the humble pastry pocket's staying power is proof that it belongs in the pantheon of great Chicago foods.
It doesn't take rocket science to cook them, that's for sure. You take them out of the package, you put it in the deep fryer, and you wait until it's done and you're done.
Since its introduction in 1976, millions of pizza puffs have been pressed, filled, hand-folded, and packaged for commercial and retail sale in Il Taco Foods' Westtown facility.
I am right now standing outside the pizza puff line, and let me tell you, if you're anything like me, this is very exciting. It's like standing outside the gates of the Willy Wonka chocolate factory. Beautiful things are happening in there, and I can't wait to see it.
It's made from scratch every single day, whether it be the filling or the dough that we make every day, and then we hand fold them. So
our employees work their tails off here, and it's very appreciated every day.
They're really good at what they do, and they really have a passion and appreciate it.
You could be forgiven for thinking a company named Il Taco makes, well, tacos. But
so that stands for Illinois Tamale Company. That would have started with my grandfather. That would be Elisha Chavez.
In 1927, Elisha Chavez bought a company making Chicago-style rolled tamales for pushcart vendors. When Warren Chavez took the company over in 1964, he condensed the name to Il Taco. By the 70s, Warren Chavez says the hot dog stands his company served were ready for something new.
My brother and I grew up in an all-Italian neighborhood. And panzerottis and calzones were huge back then. And I had a buddy called Art Velasquez. He owned Azteca Corn Products. And I said, listen, Art, let me take some of your tortillas.
Warren and his brother Edward used the tortilla dough as a wrapper for a spicy, pizza-flavored filling. He says making a pocket that could take the plunge in the deep fryer without splitting open took some trial and error. But
and son of a gun, when we put it in the French fryer, it held together, and it was amazing.
Il Taco added the pizza puff to its lineup, and it took off across the city. As the company grew, the family grew too, and Warren folded his children Alicia, Andrew, and Adam into the family business.
Of course, I used to force them to come down here. They come down here work in the summer.
Myself, I can't fold a pizza puff. It goes by too fast. The worst part about it was doing the taco puff and having to peel all the onions.
That's before we... Yes.
By far. I mean, eyes just running.
Over the past 20 years, the siblings have left other jobs to become the fourth generation of the family to run Il Taco.
We've grown substantially, and it's just been so fun to do it with two of my best friends, basically, and enjoy it every day doing it. So it's been wonderful.
I'm extremely proud of the three kids. Sometimes I almost can get the tears because that they're here.
And they say their hope is a fifth round of Shabbazes will be ready to take over one day.
It's extremely important that we do stay with it as a family company, and it would be great to see the next generation be a part of it if they want to.
Because my son right now, he drills about 3 pizza puffs a day, and it's not a joke.
I feel privileged. We feel privileged. I can speak for my brothers. It's a privilege.
So thank you for eating those puffs.
For Chicago Tonight, this is Erica Gunderson.
And you may have spotted the for sale sign on the Il Taco plant in West Town, and that's because the company is planning a big move, but they're not going far. The new facility will be in the north side Brynford Park neighborhood, and they're anticipating to move in later this year. Yum, yum. Brandis, we go back to you.
A puff piece maybe, but it looked delicious. Thank you, Paris. Still to come on Chicago Tonight, how hospitals are working to maintain capacity against the Omicron surge, one-on-one with the CEO of Rush University Medical Center.
On this anniversary of January 6th, let's confront the anger.
And our Spotlight Politics team has the latest on whether Congressman Adam Kinzinger will run for governor or U.S. Senate. But first, some more of today's top stories. As we mentioned earlier, Mayor Lori Lightfoot and school CEO Pedro Martinez are holding a news conference right now. Martinez says the schools will be canceled tomorrow, given the ongoing standoff between the district and the Chicago Teachers Union. But both stress that schools are safe and in-person learning is the best option for students.
So if there is any reason for us to shut down an entire system and go fully remote, I would be the first one standing here and telling you that that was necessary. But I'm not saying that, nor is the CEO, nor is the public health expert, because it's not necessary. So if you care about our students, if you care about their families, as we do, we will not relent. Enough is enough. We are standing firm, and we are going to fight to get our kids back in in-person learning. Period. Full stop.
Our approach forward is going to be, starting Friday, I welcome all my staff to come into the buildings. I welcome to come and join us to support our families, to support our children. And we will build plans as we support children and, again, allow schools starting as early as Friday to have children coming in for all services. And we'll continue gradually building up as we continue to have these conversations with CTU.
13,000 Cook County residents have died from COVID-19. The medical examiner's office says it passed this grim milestone today, just 6 weeks after marking the county's 12,000th death. The office also notes that more than 3.5 months passed between the 11,000th and 12,000th death related to COVID-19. What's more, 254 people died the week of December 27th in 2021, the most in 1 week since December of 2020, months before the vaccine was widely available. The county's Department of Emergency Management has also begun to deploy trailers to area hospitals to relieve their morgues if necessary. And the Department of Child and Family Services is mourning the death of one of its own. Investigator Deirdre Silas was reportedly killed while responding to a report of children in danger in the town of Thayer, just outside Springfield. Silas joined DCFS in the summer of 2021 and before that worked in behavioral health with the Department of Juvenile Justice. The union representing Silas and other workers says it'll study the facts of this incident and press for any necessary changes to DCFS operations. Both the governor and DCFS director have offered their condolences. And now, Paris, back to you.
Thanks, Brandis. As we mentioned earlier, Illinois is setting record highs for a number of coronavirus cases and hospitalization rates. with more than 6,800 now in hospitals due to COVID. According to city data, Chicago broke its record yesterday for the number of people hospitalized with COVID-19, and currently about 31% of ICU patients in the city have COVID. Meanwhile, hospitals across the state are working to maintain the ability to take patients and are delaying certain procedures amid a bed shortage. And joining us to discuss this and more is Dr. Omar Latif, CEO and president of Rush University Medical Center. Dr. Latif, thank you so much for being here. We're seeing the state set records for COVID hospitalizations seemingly every day. What is the situation currently at Rush?
Rush, like many of the hospitals in Chicago, is not currently at capacity. We have room and we have open beds. We have ICU beds and general medical beds that are certainly ample for today and for yesterday. I think where we're at, and the real answer to the question is, we're very worried about where we'll be at in 1, 2, and 3 weeks from now. When those numbers and the models continue to increase, then we'll have that even greater surge that we'll have to deal with and figure out where to take patients.
And how is Rush preparing for that?
Yeah, so it's really fairly straightforward. In any kind of pandemic, there's 3 limitations in your ability to care for people. Supplies, do you have the right amount of PPE? Do you have the right amount of IV fluids and medications? Those are your supplies. Staffing, do you have people that can staff, and beds, physical beds? In the first wave of the pandemic, as a nation, we increased our supplies and we increased our number of beds. That was the initial fear during the first surge. So we dramatically increased that number. During this surge, we realized that staffing is our greatest crisis that we're dealing with across the entire country, the state of Illinois, and the city. So specifically what Rush has done was we increased our available beds. We have a plan that allows us to flex up and flex down based on what the needs are for the community and the broader community, actually going outside of the Chicagoland area, figuring out how we can help. And we're bringing in as much staff as we can find, both our current staff, and we're repurposing staff from other areas to help create more staff beds for COVID, like all the hospitals in the city.
And part of what you're seeing from other hospitals is the delay or postponement of elective procedures or treatments for other illnesses. Are you seeing that at Rush right now?
Yeah, we are, and I think this is a complicated issue because there are people that have been in pain and been waiting and see a cure for their severe back pain or elective surgery. That phrase, it's being sort of thrown around all over the place. It's a really, really broad spectrum, and there's surgeries that are important to get done, like a mastectomy, a cancer resection from a woman that's critically important for them, versus, say, an eyelid resection. Rush, just like all the other hospitals in the city, prioritizes the cases we do based on the volumes and the needs for our city. We will absolutely postpone whatever there needs to be postponed to continue to take care of the sickest patients we can take care of.
So for a cancer patient, for instance, that needs some kind of surgery or treatment, who might be worried that they might be postponed, your message to them?
Our message is we learned from the first wave of the pandemic. Hospitals like Rush, hospitals all over the country, effectively became COVID hospitals. And people were scared. We had one patient who waited 5 days with chest pain prior to coming into the hospital because she was scared. What we learned during the pandemic was the health of our community after the pandemic was worse than it was before. Delaying the appropriate care is never the right thing. So we urge all our patients to work with their primary care physicians and their consulting doctors to make sure if there's something they're putting off, that it's okay to put off. And so critical surgeries, cancer surgeries, of course, those are surgeries we still want to do. We have to do those. Part of the new normal that exists in America is living in a hospital with COVID patients and with non-COVID patients. We have a responsibility to treat all of those, just like all the hospitals.
And with the advancement of vaccines, Doctor, there's also been an advancement in therapeutics for COVID-19. Tell us about how far your hospital and others have come in terms of treating the patients that do come in.
2 years ago, the disease didn't exist. There was sparse data coming from China, sparse data coming from Italy, sparse data coming from Seattle, sparse data coming from New York. It took us a while to coordinate and collect that data and figure out what worked and what didn't work. In healthcare, we learn from best practices. We look and say, these 600 patients were treated on this ventilator, on this setting, and this is what happened. that actually takes time to accumulate. It is 2 years later. We are one of the most advanced nations in healthcare in this world and have shared data in an open source way to learn best practices. Our outcomes have gotten better each month since the pandemic started. Mortality has continued to drop since the pandemic started because we learned how to handle the acute patients and the super acute patients in a way that really prolongs their life and in a way that minimizes mortality.
And one of the things that could prevent folks from coming to the hospital is getting tested, although there's been a nationwide shortage of testing. What do you say to folks that are looking for a reliable test right now?
Yeah, so I would really urge people to go to the IDPH, the Illinois Department of Public Health website, and really make sure that the test that you're getting is a verified or regular or a studied test. I think right now, like any other time where there's a huge need and a fervor, you tend to see some tests that aren't as good as others. What I would tell you is any reputable testing site, any state testing site, any healthcare facility, over-the-counter tests that have been validated, that have FDA approval on them, are very accurate tests and can be very, very helpful in guiding behavior. So we very much encourage people, if you're symptomatic, to get tested. That really can pull you out of the general population and decrease the spread. So testing has always been a challenge. It has always been a challenge. And every time we have the surge, we find ourselves chasing more tests. And we're in that situation now where I'm sure many of your viewers keep going to different pharmacies and are frustrated because they see online where they have them, and by the time they get there, they're sold out.
All right, Dr. Latif, a lot for residents and a lot for you to manage at your hospital. We thank you very much for joining us.
Thank you.
And up next, our Spotlight Politics team with more on the fight between CPS and the Teachers Union. But first, we take a look at the weather.
What is the political fallout of the standoff between the teachers union and the city? The race for the 1st Congressional District heats up after Bobby Rush announces he's stepping down, and Congressman Adam Kinzinger decides his future on the eve of the January 6th Capitol riot anniversary. Here with all that and more are Amanda Vinicky, Heather Sharon, and Paris Schutz. Welcome back, team. So, the Chicago Teachers Union voted to skip in-person learning today, and we know that it will happen again tomorrow, as we heard earlier. Mayor Lightfoot held a press conference this evening. Here's a bit more of what she had to say.
We will not relent. Enough is enough. We are standing firm, and we are going to fight to get our kids back in in-person learning. Period. Full stop. We owe that to our children who suffered learning losses. I need you to report about the fact that 100,000 children were disconnected and disengaged when we were fully remote. 100,000, mostly black and brown and poor kids.
So Heather, let's start with you then. What is the political fallout for the mayor with this standoff?
Well, it could be severe. There are more than 300,000 students who have not been in school today and will not be in school tomorrow. And it's not clear when they will return to school, whether in person or remote. And this is really because both sides, both the mayor and the Chicago Teachers Union, agree that we're at a moment of crisis in the COVID-19 pandemic, but they disagree on about how to approach that. And the mayor, as you just heard, wants kids in schools, while the union is concerned that students will get COVID, get sick, and some of them will get seriously ill and die, not to mention teachers and staff as well. The mayor, however, is under pressure from national politicians, Republicans, to get the schools back open again. And it really goes to the heart of her sort of pitch to voters that she is a competent executive and that she can keep the city functioning, which can't happen with that many kids out of school for, at this point, an indeterminate amount of time.
Tough to make that case, yeah. And we also know the union's vice president, Stacey Davis Gates, she's quoted in another news outlet saying, quote, "We're between a rock and a hard place, the rock being the pandemic, the hard place being an intractable, incompetent mayor." Heather, this is getting nasty. Is this the worst that we've seen it? Making it even harder to get an agreement.
Yes, there is no doubt that there is no love lost between Mayor Lori Lightfoot and Stacey Davis Gates and other union leaders. They have been at odds since day one, hour one, minute one of the Lightfoot administration. And because this is such a big crisis in COVID-19, it is making it worse because there is a distinct lack of trust on both sides. We heard the mayor say just a few minutes ago that she doesn't trust the CTU to only go remote for a couple of weeks until January 18th, which is what they've proposed. And the union does not trust Lightfoot or her staff to put restrictions or new rules in place to keep kids and staff safe from getting COVID-19. That makes it a really hard position to reach any sort of agreement, which is why there's no end in sight at this point.
And it could get even worse, by the way, because we did just hear from the mayor that she has begun pursuing legal action, filing an unfair labor practice complaint that would take this to another level. And by the way, it's not just Chicago who's got their eyes on this. You're getting particularly some of the Republican candidates for Illinois governor and those in other races outside of the city following this and saying, painting this as a political issue, particularly against Democrats, as saying, hey, look at what happens when a city is run all by Democrats, wresting control from parents, get your schools under control.
Paris, despite all of these ongoing challenges that the mayor faces with the CTU, the pandemic, the city's violence, any question that Lightfoot will run again?
It doesn't seem like it, Brandis. She's barnstormed the country raising money, all but saying she is running again. She hasn't officially said that. So as difficult as these challenges are, I would be surprised if she came out and said she didn't want to run again. And I would echo Heather's comments that, yes, there are teachers that are very, very concerned and frustrated with the COVID mitigations from CPS, but so much of this from CTU and from the mayor is political. The CTU has been against Lori Lightfoot from the beginning. The 2019 strike, the work stoppages last year, a lot of it's political, a lot of it parallels the way these things go. Their candidate for mayor was Tony Preckwinkle. Now, Lori Lightfoot, in those comments, the mayor, I sense politics in those comments. She's trying to get Chicagoans, she wants to be reelected, trying to get Chicagoans to see her as someone who is standing up and banking on the fact that public opinion, if this is the case, public opinion falls on the side of wanting kids in class. But then let's toss that aside and just acknowledge the frustration for families right now, finding out at 11 o'clock last night, and who this hurts the most, low-income students, as the mayor said, black and brown students. By the way, CPS lost track of a lot of those students last year. This is really, really devastating for families, and it underscores the fact that I don't know if they can do this, but politics does need to be put aside, and they need to find some kind of resolution.
Yeah, it's pretty ugly and frustrating for a lot of parents. Moving on to Congressman Bobby Rush's announcement that he will leave the House next year, set off a scramble to replace him. Here's what he said yesterday.
I am not retiring, I am returning.
Amanda, why now for Congressman Rush after, 30 years, 23 other House Democrats walking away?
Well, I think a lot of people during the pandemic have really reassessed their priorities, what matters in life. And he has said that it simply comes down to, no, not the rhetoric in Washington and the partisan divides, but it comes down to wanting to spend time with his grandkids and wanting them to know who he is from something beyond a TV screen. So sometimes it really is just as simple as that. And of course, Rush, as he noted, returning, he also is going to be leading religious services, taking a bigger role in his church. He's got roots as a Black Panther and a barnstormer, so he's not one for settling down, even if it's not going to be in Congress.
Paris, we know that Alderperson Pat Dowell changing lanes from running for Secretary of State to running to replace Rush in this in the 1st Congressional District. Does this make sense? Just after, because she was not slated by the party for Secretary of State.
Yeah, and Dowell's been a committee person. She's been very active in the Democratic Party. She felt that it was a slight against her that the Democratic Party endorsed Alexi Janulius for Secretary of State. So she decided to pivot and run for this seat. She's a veteran at this point in politics, but you're going to see a lot of folks declare for that seat. This is going to be wide open, and a lot of folks with a lot of experience, possibly. You already have the community activist Jamal Cole jumping in, possibly people like Senator Robert Peters, Senator Jacqueline Collins, and a whole litany of folks. And it'll be interesting to see who Rush endorses and who the party endorses here.
Heather, any thoughts on or any expectations on who he might endorse in the race to replace him?
Well, he really has the possibility to be a kingmaker in this race because he is beloved in the district, because Amanda talked about that 30 years of history. There is reports tonight that he will endorse Karen Norrington Reeves, who is the executive director of the Chicago Cook Workforce operation, and they have been really involved in responding to the COVID-19 pandemic and running contact tracing and job training. So she's very active in the community. That will have a big impact. And it sets up what promises to be a hard-fought race for a congressional seat on the south side of Chicago that does not come open very often, which makes it a prized political plum. I will note that it is somewhat interesting that we now have two sitting members of the Chicago City Council running for Congress, along with Alderman Dowell. Alderman Gilbert Villegas wants to be the congressperson in a newly created district on the far northwest side. So if they both win, it will by default seriously reshape the city council even before the next elections in 2023, because of course this race is a freebie for them because they're not up for re-election for another year after this race, which could give Mayor Lightfoot a chance to appoint some perhaps friendly places on the city council.
So Congressman Adam Kinzinger, he has announced that he will not run for governor or senator. Paris, he says that he wants to right the GOP instead with his Country First group. Do you believe that he's got loftier plans running for president, maybe?
Well, if you talk to folks in Illinois Republican circles, folks close to Adam Kinzinger, they do believe that he has loftier plans to possibly run for president. His stated goal right now is to move the Republican Party away from Donald Trump, to move it away from extremism. He is adamantly opposed to the extremism that's overtaken the party. Representatives like Marjorie Taylor Greene or Matt Gaetz, he wants to do away and take the party in a new direction. This Country First will be a PAC that raises money and supports candidates in his mold, and perhaps he'll have a platform to run and challenge possibly former President Donald Trump in a primary in a couple of years. But it's clear that he's not going to run for governor or senator because he doesn't believe accomplishing this overarching goal with the Republican Party. In the country, by the way, it won't be accomplished with running for those offices.
Congressman Rodney Davis will be facing off against Trump-backed Representative Mary Miller downstate. Amanda, is the mud already flying in that race? And does having Trump's endorsement, does it really give Mary Miller the edge?
Oh, the mud is most seriously flying. Yes, Brandes. I mean, you know, this is a district that is drawn to benefit a Republican. Ostensibly, the thought was, well, yeah, that's a seat drawn for Rodney Davis, keep him potentially out of the race for governor. He was seen as somebody who might have a chance at really taking on Pritzker. But this is something that happens as we talk about redistricting, another sort of synonym for it, gerrymandering. And as you draw districts that are drawn really to favor one party or the other, they tend to be ones that don't elect a moderate and instead would get somebody on either spectrum of or on either side of the political spectrum. And so, yes, I do think that this puts Rodney Davis, that's why you're seeing the mud being flown around. He has sort of the establishment behind him, but Miller has Donald Trump, and this is a new district. It is hard to tell where people are going to go. She lives outside of it, and so it's part of a familiarity thing, but it is one that is going to be watched closely, not just in Illinois, but nationally.
So let's jump down to some state politics before we let you all go. The General Assembly shortened the already short Springfield session. Amanda, back to you. First order of business was a vote to allow virtual voting again.
Yeah, because I think the expectation was, but everything will be normal in 2022. Don't have to do this again. Lo and behold, of course, here, unfortunately, terribly, we all are again. And so now that has been extended once again through June to allow remote voting. And by the way, things got off to a really slow start in Springfield because there were, in part, so few legislators there. because it is believed at least some had COVID concerns, quarantined, or had COVID themselves, and also a sort of protest because, again, redistricting rears that head yet again as Republicans really trying to protest what Democrats are doing in reshaping judicial districts. But remote voting is allowed, and so they might not have these quorum issues that delayed things today in the future.
Okay, I'm sure you'll keep us posted on it. A lot to talk about, as always. But until next week, to our Spotlight Politics team, Amanda Venicky, Heather Sharon, and Paris Schutz. And we're back to wrap things up right after this.
Chicago Tonight is made possible in part by Alexandra and John Nichols, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
And that's our show for this Wednesday night.
Please join us tomorrow night live at 7. 1 year since the January 6th Capitol riot, what has the country learned and what's next?
And how the latest COVID surge and canceled classes are impacting the Southwest side. Clearing is the next stop for our In Your Neighborhood series. Now, for all of us here at Chicago Tonight, I'm Brandis Friedman.
And I'm Paris Schutz. Thank you so much for watching. Stay healthy and safe, and good night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a personal injury law firm pleased to give back to the community through numerous charitable initiatives.